To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
Today I'm going to speak about, first I'm going to tell you a little bit about myself, how I got into nursing, and then probably what you're really interested in is how COVID changed all of our lives in the nursing profession and in the medical profession and in the world. I have been a nurse for 42 years, as Jennifer said. I started out receiving a Bachelor's of Science at Molloy College, went on to receive my Master's of Nursing at NYU. And through my 42 years, I've done different positions. I started as a clinical nurse at the bedside. I then progressed to becoming a clinical nurse specialist because that's what my master's was in. And I did that in neuro and neuroscience. And then I became an assistant nurse manager, a nurse manager, and in between, I've been an adjunct professor at Molloy College. The reason I went into nursing is because I always wanted to help people. I started out very young wanting to be a teacher, and that I was able to combine both nursing and teaching. And the reason I actually went into nursing is because I volunteered as a candy striper when I was about 15 years old in a hospital. And what I found is that I loved helping people. I loved being there even at the worst times of their illness, because I really could make a difference. And that's what I wanted to do with my life. I wanted to make a difference for people. In the unit that I presently work in, it is a 20-bed medical ICU. And St. Francis is a 306-bed hospital in Roslyn, New York. And we see multiple different types of illnesses, a lot of cardiac, but we also see other illnesses. In my unit, we do neurointervention, we have patients on ventilators. So we have a wide variety of patient illness, and some people go home and some people don't go home. When COVID-19 hit, at that point, I normally am supposed to work about 7.5 hours a day. And as a nurse manager, I've always felt an obligation to the patients first, the families, and my staff. So those 7.5 days were actually probably 9.5-hour days. When COVID hit, it became 12, 13-hour days because what we saw was something I'd never seen in my career, really never want to see again. We went from a regular ICU with sick patients to 20 beds of incredibly sick patients. Patients on all kinds of machines, life support, and they weren't getting better. And that was the really scary part. And it wasn't age specific. I know when COVID first started coming out, where people were hearing about it, everyone thought it was elderly, the elderly that were affected. But we saw ages, the youngest patient on my unit was 22 on a ventilator, and the oldest was close to 100. So it was a very wide range of people. We had a lot of people in their 50s. And when you look at how people normally do, the predictors of how they will come out of the ICU and how well they will do and go on with their lives, a lot of it's based on what we call their comorbidities or past medical history. So if you have cardiac disease or lung disease or diabetes or you're a smoker, those things always will negatively impact the outcome of your hospitalization. With COVID-19, there was really no rhyme or reason. It didn't matter how what the comorbidities were for these patients. They came in, they were incredibly sick. So some of the things that I think I've learned in my career, one of the biggest things is that every day when I go into work, I give 110%. It's the only way that I believe you really can make a difference. If you go in half-heartedly, you're never going to impact people's lives. The other thing that I've really learned, because I've seen so many people pass, is that there's no guarantees with life. One minute you're having fun with your family and doing all kinds of things, and the next thing, tragedy hits. And I also really have learned to value my family, that my family comes first and my career second. So what happened with COVID that made it really difficult from my perspective was that first, we were not allowed to have families at the bedside. And there was a really important reason to that. And most of it was that we couldn't expose my team or the team of healthcare workers to more than we were already being exposed to, because if the healthcare workers got sick, there would be no one to take care of the COVID patients. The really hard part about that is not having the families there, was that these patients were incredibly sick. And the families, we would call them every day. We would be in touch with them by phone initially. And it was so hard for them not to be able to see what was really going on with their loved one. So we started, as my particular unit, working to get iPads. And the first donation came in, and it was actually from my brother who lives across the country. And when he heard my story about how difficult and upsetting it was for the families and that patients were dying alone, he had donated an iPad to the unit. And then one of my nurses' families donated another iPad, and we wound up with actually enough iPads that we supplied other units with iPads. And then the hospital also was able to get iPads, so every unit had an iPad. And that really did make a difference, because then at least the patients' families could see them. They could see them. It wasn't a pretty picture. They were on ventilators. They were on multiple drips. But my nurses, like they always do, went way above and beyond. And they would do things before they would sign on to the iPad, like make sure that the patient was as presentable as possible so that the loved ones could really see them in the best possible vision, with their beard shaved or their hair combed, even though they were still on life support. And unfortunately, many patients died, but at least the families got to speak to them and see them and say goodbye to them. And that was really heart-wrenching. I still get choked up about it because it really, it was a difficult time for everyone. I think the next thing was the emotional part of it for me and my staff, to deal with so many people dying. So we did things, and Jennifer has shown some pictures on the screen. We realized that we really were the superheroes for these patients. So my nurses would do things like write inspirational sayings on their protective gowns, or they would write things on their mask. We made a whole board of superheroes with Wonder Woman and Superman emblems on our gowns. And those are the kinds of things that helped us get through such a really incredibly difficult time for us. I think that the other big piece of this disease that a lot of people, what I'm seeing now and what makes me fearful, is that people aren't understanding how this disease spreads. We have politicians who are going out in public and not wearing masks, and they're telling people it's not important, when the truth is the masks save lives. You know, you can see in this picture where my nurses are completely gowned up, and they have masks and they have headgear on. They wear gloves going into the rooms, and we had a really the only staff of mine that got sick from COVID were from being exposed from family members and being exposed on the outside, not from their exposure in the hospital. So gowns, gloves, all that stuff helped us. But the most important thing is understanding how COVID spreads. And COVID spreads through the mouth, nose, and the eyes. You can actually get it. And so if I were to cough and you were near me without a mask and I didn't have a mask on and I had COVID, even if I didn't have symptoms, I could spread it to you. And what they discovered was it's a cough or sneeze can travel as far as 6 feet. So that's the whole point of social distancing, keeping the 6-foot difference and then wearing masks. And so when I see people out in public that feel that it is their civil right not to wear a mask or whatever their feeling is about it, it's very upsetting and frustrating for me because I've seen the worst of it. And I don't want to see people get this, and I don't want to see people die from it. And it's a fairly easy thing to do is to not be so self-centered and to wear the mask and to make sure that you are protecting not only yourself, but your loved ones. So on my way to work, I always go under this one particular bridge, and months ago, someone hung a sign, and it really, really kind of summarizes wearing a mask. And to paraphrase it, it basically says that you may get COVID and survive, but your grandmother won't. And so that's the point, that it could be a young child, it could be a sister or a brother. Some families lost multiple family members during the crisis. So that's really, I think, the important things that I wanted to talk about. The other piece is that this disease affects everyone very differently. We have people now coming into the hospital and we're finding them to be COVID positive, but they're not having any symptoms. They're coming in for surgeries or for chest pain. And so we call it an incidental finding. We're still isolating them. So you can test positive 90 days out from the actual contracting the disease. So it's important to know that it affects everyone differently. Some people died from the disease and some people just didn't feel well. Some people were able to stay home and fight the disease but were sick for weeks. And some people are still having lung issues because of the way it negatively affects the lungs. So I think the important thing of what you can do for yourself is A, wear a mask. That decreases everyone's exposure, including yourself, and to take care of yourself, just in general. And that was one of the things that I had to be separated from my husband for 3 months during the crisis because my husband is immunosuppressed. So we were separated, our household, and that was really important for his survival and for me to be able to go to work every day and spend the 12 hours there and not worry about him. So my daughter is, she was home with me and she is young and healthy. And so we did things like make sure we ate healthy, that we went for walks after I got home from work, even if it was 8 or 9 o'clock at night. The picture you see now is one of our survivors. This particular, and the young woman is my assistant nurse manager, Shannon Sullivan. And this gentleman, and he gave us permission to share this photo. He was in the hospital for about 9 weeks, and multiple times we didn't think he was going to survive. We coded him several times, and we actually were able to pull him through. And one of the things he said is that we became his family when his family wasn't there. And as you can see in the picture, he's not only survived, but he's doing extremely well. He's home. He still has some physical disabilities that he's working on with physical therapy. But when Shannon saw him that day, it was at her beach club. They have a mutual friend that connected them. She actually broke down and cried. She said she couldn't even speak to him because it was so emotional to see him with what he went through, and for him to have survived. It makes our job so much more meaningful. So I think that's my 15 minutes, Jennifer.
Thank you so much, Ms. Lori, for what you do A nurse's job requires her to sacrifice so much of herself for strangers, and your own life was at risk during these past few months. I know that nurses work really hard and really long hour shifts. You mentioned about 12 hours. And, my father, in the past, he was sick as well. So I visited him, and, what the nurses do every single day is not easy. Can you just tell me about your job related work of what you do there, and especially during the pandemic, what did your schedule look like? Was it more hours for the nurses, or how was that intensity?
So yes, there were definitely more hours. I'm an 8-hour employee and I work Monday through Friday, but my nurses are 12-hour employees and they normally work 3 days a week. Some of them were working 4 and 5 days a week. We also, in our hospital, and I think this happens in many hospitals, because we weren't doing operations, the OR staff, the recovery room staff, the cath lab staff, they were all retrained and redesignated to areas to supplement our staff so that we could care for these very sick patients. Each day varied. I'd get in by 6:30 in the morning and never leave before 6:30 at night. And I did a lot of bedside care with my nurses because it really, they say it takes a village to raise a child. It took a village to take care of these patients. So, and the nurses were really the front line at the bedside. We were at the bedside full time. Not all the professions were.
Well, it's like a whole team supporting just to save one life, which is a really beautiful thing. You also mentioned that one of the hardest parts of your job was having to see loved ones of your patients say goodbye, or just coordinating those last few hours of a person's life. Can I just ask, I know it's a hard time, but how do you deal with those last moments of a person's life? Or how did you tell your nurses, or how did you tell the patients, or what was the best way for that?
I can say I didn't have to tell my nurses because their hearts and souls are in their work. But dealing with the families, we were regularly in touch with them. So several times a day, they would get updates about how their loved one was doing. And when that particular person we knew was moving towards end of life, we would talk to the family, see if they wanted to, for us to get the iPad so they could see their loved ones. And I can give you a perfect example. We had one patient and he was actively dying. And so his wife wanted to see him. And they had been married, I think it was 40 something years. And so it was really heart-wrenching. And so my nurse went in and she fixed him up as best as possible. And then she brought the iPad in and she put the iPad right by his face so that his wife could tell him how much she loved him and how much she was going to miss him. And then after that, my nurse sat with the patient holding his hand, and she had her phone with her at that time. We normally don't keep our phones at the bedside, but we did it to be in contact with the families. And so his wife sent a picture of them in happier days. And my nurse cried with her. She called her on her phone and she cried with her. And that was how they were able to grieve together for this man who my nurse didn't really know until he became a patient in the hospital. But they became, they're always human beings to us. And I think that's the important thing, that when someone is so sick and attached to all kinds of tubes, you have to remember that that person has a family and they have loved ones and they had a life before they came into the hospital. And we have to honor and respect that in every way we can.
Yes. Being a nurse, it's not just, learning all the physical body parts and physical knowledge, but, learning about the world of the heart, learning to be considerate, learning to serve others. Those are great qualifications for a nurse. Before, you were also mentioning about the masks and how you felt it was very important for people to wear them. Is there a certain type of mask that hospitals and doctors recommend? I know these days they have a lot of do it yourself, making a mask at home, but is there a certain preference or something you think is more safe?
Um, the important thing is that you wear something, some kind of face covering. The really important thing, and this I see a lot of, is people wear their mask to here. So their nose is exposed. That's not safe. You might as well take the mask off. Cloth masks are fine. The important thing is that you're washing it at the end of the day. In the hospital, we wear what we call surgical masks, and those are those blue masks that you see in all of our pictures. We also wear what we call N95 because we are directly exposed to what we call the aerosol of the disease. So when someone coughs or they're on a ventilator, there's an aerosolization that means that it's in the air. So you can see in this picture, all the masks that we have on, those are called surgical masks. When we go in patient's room, there's a young woman in the background who has a blue kind of, looks like a harder mask. That's an N95. There are N95s for all different kinds of professions. We have to have a medically supplied one, but for the normal person being outside, visiting with family, being around family, or even going to the stores, any kind of covering of the face, the nose, and the mouth is good. So, but I always say make sure that if it gets damp or moist, which it does because you're breathing in and out, to make sure that you wash it.
Oh, I see. Yes, the mask definitely saved you guys and helped you guys for you to be in that room full of the patients and not to be even infected and be fine. It's really a lifesaver. And I think yesterday you were mentioning about how New York and the rates are doing, because we've definitely seen a difference of New York and other states. Can you just talk about how New York has been doing with the rate status of the coronavirus, how people are affected, and why do you think it's like that?
So our rates are one of the lowest in the country right now, and that is because we did the right thing. We closed our state down. People stayed home. Businesses unfortunately suffered, but people didn't get sick and die, and that's really the important part of what we did. The more southern part of the country, as you see when you look at a map, they're all highlighted in red, and that list is growing every day. These are states that the numbers are going up. So if you have more than a 10% increase of the COVID virus, new cases each day, you are considered a high-risk state. And that is why if you're in one state and you travel to, say, New York, and you're coming from a high-risk state, you are told to quarantine. Unfortunately, people are not cooperating with that. If you fly into New York to any of our airports, you are then monitored by the Department of Health. You receive a call every day. They're checking in on you. They're making sure you're monitoring your temperature every day. We in the hospital monitor not only our temperature every day, but our oxygen saturation. And but the people that are driving in, it is really up to them. It is not a perfect system, and I wish more people would be respectful of the disease and their fellow human beings and quarantine the way they're supposed to. When you don't quarantine, you are exposing everyone you come in contact with. And you may never get sick from the virus, but you could be spreading it. And that's how it spread so quickly and how we had so many cases in New York State until we shut down. And once we shut down, we were able to protect New Yorkers. And we did it very smartly and kept us closed down until we saw the disease level off in our state. And once we leveled off and started to decrease how many new COVID cases, and that's what they base it by, how many new COVID cases you have every day, that's when we started opening up. But now what I'm seeing on the news, like for example, in Astoria, Queens, people are going to bars and they're not social distancing and they're in the streets. They think because they're outside, they're safe, but they're not. And that's what makes me fearful that our numbers are going to start going up. We haven't seen that rise yet. In the hospital, like I said, we're seeing mostly 99% of incidental findings, but we just had a new case just recently. And so that means that it's still out there and it's still active.
See, I think most of us in this room are probably really wondering, is there any information about a vaccine coming out soon, or when do you think a cure will come out?
So the COVID or coronavirus is in the same family as the flu. I don't think we'll see a cure. I think we'll see a vaccine. The problem with vaccines, like anything else new in the medical field, it has to be tested. And we have to be careful about the way we test it. Some people say that within a year from last March, we would have a vaccine. Some people say 2 years. Some people say 6 months. I don't really have the answer to that, and I don't think anyone does. I think we're all praying that the sooner the better. But at the same time, we want a vaccine that is really going to work. We don't want a vaccine out there that is either going to do more harm than good or not protect us. And we think we're taking this vaccine and we're safe, and we're not. So that's why it's better that we take a little more time and get the right vaccine.
So it'll take maybe in less than a year if we'll see any kind of result.
Very hopeful for less than a year. I know there are at least 6, the last that I heard of from our infectious disease physician, because we do calls like this on a regular basis. And the latest is that there are 6 promising vaccines. But again, the testing and everything else is going to take some time.
I see. I have one more last question before I open it up to the students. So I know that in your bio it said that you've been working as a nurse for about 42 years. It's a very long time period, especially for the younger generation where we like to change our jobs quite often. But you were able to stick with it for 42 years, and I know it's not an easy job. What is like the one thing that you learned when you're meeting so many different people and just viewing life in itself? How have your thoughts changed, and what is the main takeaway that makes you want to keep doing this?
I think for me, and I've told this to my own children, that it's really important to find something you love. And for me, it was something that helped people. And I may directly help people, but there are other ways of helping people. Like I have a daughter that her business is all online, and she does, she's a coach, a business coach. But she helps people in her way. And I have a son who is a fireman, and so he helps people in his way. And I have another son who does IT, and he keeps us up and running. So, so the important thing is to find something that you love and really stick with it. And you may have to go different paths to find that, but when you do, I think you dedicate yourself 100% to it. And I think having a good work ethic, knowing that you showing up really makes a difference is really important to remember. You know, not everyone can stick with something for 42 years. I found something that I truly loved. And I have nurses that move on to other areas of nursing. So it doesn't have to be that you do one particular thing in the field. You could have other avenues to explore. But I think if you keep jumping around and don't give it enough time to see if it's something you really like, you're never going to find something you really like.
Yes, I totally agree with that. Sometimes it does take time to adjust and find that passion for it. So now this is the time I'm going to open it up for the students, for them to ask questions. Our first person that we want to go to is Hillary from Faith 20. Hillary from Faith 20, can you please unmute your mic and ask Ms. Lori Brush your question? Ms. Hillary from Faith 20. Is she here? Oh, I see. Oh, you have to unmute your mic. We can't hear you.
Okay, can you hear me now?
I can hear you.
I was wondering how long it lasts on surfaces. Like, I know we have to wear the mask and they talk about hand washing, but I'm just not sure, like if someone had COVID and they coughed on a surface, like how long it lives there before it dies, or does it die, or do you know?
It's a great question. And yes, it does last for several days on surfaces.
Okay.
But here's the good news. And so I have hand sanitizer every place I go. I have it in my car. I have it in my pocketbook. I have it in my office. So the important thing is that, at this point, if you're not having a lot of people in your home, you're not having parties, and you're doing your regular cleaning, you're fine. When I go into a store, and you probably think I'm crazy, but if I use my bank card, which I use a lot of, I put hand sanitizer on it and I wipe it down and I let it dry before I do anything else. The first thing I do when I get in my car is I hand sanitize my hand, and I'll periodically wipe down my steering wheel. And so what's really important is that you're washing your hands. In everything we do in the medical field, hand washing, you can wear all the protective equipment you want. Without good hand washing, you're behind the times. So good hand washing, having hand sanitizer, it has to be at least 70% alcohol. So that's another important thing to know. Look at the bottles that you're buying, because some of them are less than 70%, and so they're not as good. They're not terrible, but they're definitely not as good. Once you hit 70%, you really know you're killing the germs.
Thank you. Next, we actually have a question from Mr. Jen Zhang. Actually, my husband. Okay.
Hi, can you hear me?
Yes?
Oh, hi. Thank you for sharing your experience today. I know it's a very hard job working at the very front line of the COVID. If this is a war, I think you're the very, very front line of this war. And I heard your speech saying people death every day. My question is, how do you maintain your mental healthy? Because I saw a news that Dr. Lorna Breen, she committed suicide during the COVID. So this is my question: how do you maintain? I mean, your or either the doctor, how do they maintain their mental health during this COVID?
So we had a lot of resources. At our hospital, we have a department that offers psychological, financial, all kinds of counselings. So some of my staff use that. We use things like I talked about with making ourselves superheroes. I found coming home at night, going for a walk, really made a difference. It helped me unwind. And so I told my staff, I also do yoga every day. Before I go to work every day, it doesn't matter if it's 4 o'clock in the morning, 5 o'clock, I do at least 10 minutes of yoga. I find that helps relieve the stress of my body and also help clear my mind so that I can start the day fresh. A lot of people did a lot of exercising. They did things like, tell funny stories. There are people that had no support at all. And those are the people that are at most risk. So the other thing that we did is we huddled before every shift in my unit, and we did it throughout the hospital. And we talked about our fears, and it was realistic to be afraid. It didn't mean we weren't going to go take care of the patients. It just meant that we were able to say, you know what? I'm really afraid. I've never seen anything like this. I'm afraid for my own health. I'm afraid for my family's health. And we would talk about it. And sometimes we would cry. Sometimes we would hug. And, you weren't supposed to hug, but sometimes you needed that. So those are the kinds of things we did. And I think that no matter what you do in life, you have to remember that if you don't take care of your body and your mind in some healthy form, that you are not going to do well day to day. So I found yoga, I'm a big sweets person, so I probably ate more sweets during the COVID crisis than I have in a long time. but that was a comfort food for me. So I ate healthy, but I also ate a lot of junk food in between. So, they say the college, what is it, the college 5 or whatever, I did the COVID 5. So probably a little more than that. But anyhow, so that's the important thing, is that you find ways to take care of yourself that are healthy. Not smoking. I mean, I'm a big component of not smoking because it's really not good for you in any size, shape, or form. But for me, it was yoga. It was going for walks. Bicycle riding, whatever got me out of my own head is really what helped me.
It's definitely body, mind, and soul. You have to take care of all parts, and really
Absolutely.
it's people all helping each other, right? You're helping them, they're helping you. We're all in this together. We have actually one more question from Clarissa Slurfon from Passion E4. Miss Clarissa Slurfon from Passion E4, can you unmute your mic?
It's actually Valerie.
Oh, okay.
Hello, how you doing?
Hi.
I'm a nurse student right now, and it's been tough because they put my classes on hold. But I finished all my basic classes, and right now I had to take tests to go straight to the LPN, right? So my question is, the government said they want to open up the schools. But I asked myself, if they open up the schools without the vaccine, I'm not gonna feel comfortable going. I don't wanna expose myself, and I'm wondering if you know what they planning to do. I don't know if you know, but I just wanted to ask somebody.
So there's a lot of talk about different ways that they may be returning to school starting September. I think anything that can be done online should be done online. But there are certain things that you need the classroom for, and that goes for children from kindergarten up all the way through college. So some of the things that I'm hearing is that they're going to do a rotating schedule, so that if you're in group A, you'll go to the classroom on, say, Monday and Tuesday, and then your peers on group B will go Wednesday and Thursday. And I think the important thing is that, like I talked about before, wiping the surfaces down, washing your hands, wearing a mask, doing everything to protect yourself, and being 6 feet away from your fellow students is the way to protect yourself. And it is definitely shown that it works. So I think it depends on how they open the schools is going to make the difference. And as long as you know that you are protecting yourself and that you are using good hand washing technique, remember, everything you touch is something that could be contaminated, so always wash your hands in between. And I always tell everyone, wash your hands before you eat anything, and try not to touch your face and your nose, because again, your hands are always the dirtiest source. It's when you start touching food and start touching your face that you start spreading it.
Okay. Our next question is going to be, now it's going to be Clarissa from Passion 4, E4. Clarissa, can you unmute your mic, please? Passion E4, Clarissa Slurfon.
Hi. I was actually wondering, when you get the COVID-19, how long do the symptoms usually last?
I'm sorry, could you repeat that? How long does what last?
The symptoms usually last.
So that's a great question, and it really varies from person to person. So we have seen people that, the ones that get very sick, they tend to have ongoing symptoms for a long time out. Some people have symptoms for a couple of days, some for a couple of weeks. There's no real rhyme or reason. Like, I couldn't predict, I'll give you a perfect example. We had a 22-year-old who came into the hospital, and you would think a 22-year-old would be fine. She wound up on a ventilator. We were able to get her off the ventilator, and she was able to get out of the hospital within a few days. But she was incredibly sick for those couple of days. So it really varies. And there are people walking around out there that actually had COVID and didn't know it because they had basically no symptoms. So there is no medical professional would be able to give you an absolute answer for that. The important thing is, though, that if you are not feeling well and you are coughing and you are feeling short of breath, that you go and see someone immediately. We find that the earlier we treat it, the more successful we are at treating it. We've also changed our treatments. When it first hit in the middle of March, we were following the guidelines of some other countries. And what we found is those guidelines weren't the best guidelines. And now we're treating it with, we have a very specific regimen of treating it. And the people that are getting those treatments are doing very well.
So at this time, please everyone say thank you and bye to Miss Lori Brush.
Bye, stay well. Thank you.
Thank you. Thank you.
Sure.
Thank you very much.
Be healthy.
Bye.
Now. Thank you.
Healthy, stay healthy. Thank you so much for sharing.
Thank you. Please take care.
What a good job.
Take care, everyone.
Thank you.
Bye now.
Bye.